Why does dry mouth result in tooth decay and gum disease? So that's an important question. And the answer is because when our mouth does not have adequate saliva or hydration, the bacteria that normally live on our teeth or grow, there's a normal flora of bacteria that we have in our mouth, but also when we eat certain foods, especially sugary foods, we're going to have bacteria colonies start to accumulate on and between the teeth. Typically, saliva helps to wash those away a little bit, not to mention drinking water and so forth. With dry mouth, those bacterial colonies tend to stay on the teeth. And when plaque and bacteria stay on the teeth, that's an automatic recipe for tooth decay and gum disease. So how can we fight that? Well, obviously medications are important, so you don't want to stop your Parkinson's meds unless you're under the direct guidance of a physician to try to do that. I doubt that would be recommended. But what you can do that's over the counter, there might be a prescription version of this, but I'm pretty sure it's over the counter. There's a mouth rinse called Biotine, and there's also a spray version of it. And Biotine essentially is kind of a synthetic saliva. So it is a way that you can you can keep your mouth moist, and it's essentially just an oral rinse. And you can do it a couple times a day. I'm not sure how many times exactly is recommended, but you can do it a couple times a day at least, or the spray, and that has material in it that is very similar to saliva, and it can keep your mouth a little bit more moist during the day. Other thing you can do that's even in addition to that is just to continue to hydrate and drink adequate amounts of water. We could talk about that in another live about hydration and Parkinson's and why that's crucial. This is just one of the reasons is dry mouth. But anyway, the other thing you can do is chew gum. And I don't recommend chewing just any kind of gum because a lot of gums are full of sugar. But there are gums out there that are sugar-free. They have either sugar substitute. Unfortunately, they're processed sugar sweeteners sometimes, but or they may have some natural sweeteners like stevia or things like malitol, sorbitol. I'm trying to think of the other artificial sweeteners out there, but essentially they're not sugar, so they're not going to promote as much bacterial growth when you chew it. So chewing that can really help. Trident is a brand in particular that has been recommended by dentists over the years because it really is sugar-free, and it allows you to be able to chew gum and not have the added risk of sugar and increased cavity risk. It actually can clean your teeth a little bit to chew something like Trident or a gum like Trident, and chewing the gum can also help keep the mouth a little bit moist because of saliva production of having something sweet or tasting sweet in your mouth.